everyone, I'm Dr. Tan Yi Ping, consultant obstetrician and gynecologist. So this topic about ovulation bleed. Ovulation bleed, we say, is bleeding during ovulation. Little bleeding, you know. It's usually some spotting or some staining. It can be for 1 day, 2 days, 3 days, but not too many days. And it happens usually in the mid-cycle. Mid-cycle is roughly when you're supposed to ovulate. It's not normal and it's not a normal thing. Because if you actually go and Google sometimes, when you Google, you can actually find that it's written there, ovulation bleeding is normal. You know, medical textbook, they will actually write there, ovulation bleeding is normal. Signs of ovulation, staining or spotting, that is normal. But today, if you ask me, is ovulation bleeding normal? My answer to you is no. There is another condition we call intermenstrual bleeding. Intermenstrual bleeding is when you have one menses here and you have one more menses here, you have two menses, 1 month apart, and in between you have this little bleeding. That is called intermenstrual bleeding. Intermenstrual bleeding sounds like ovulation bleed, doesn't it? But ovulation bleed is normal. Intermenstrual bleeding is not normal. Oh, confused. So what is it? Okay, this is because of change in advancement in medicine and advancement in technology. That's why things are changing. All along we know that intermenstrual bleeding is not normal. But we define ovulation bleeding as normal. But ovulation bleeding is also an intermenstrual bleeding. It's not due to ovulation. It can happen exactly during ovulation, before ovulation, after ovulation, but it's not due to ovulation, it's due to something else. It is usually due to some growth. Number one, simple things, infection. Infection of the cavity of the uterus. Sometimes inside the uterus is infected. So when we look at you outside, you're normal. Scan everything normal. And then when we do a pap smear, also normal. Because pap smear is outside, it's not in the cavity of the uterus, okay? So when you do pap smear, we only see this part, the vagina and the cervix. We don't see the cavity. So if you have infection of the cavity, we won't be able to know. So everything looks normal. Then when we do a hysteroscopy, where we scope inside, where we put a camera inside, then only we can see. Number two, what else? Other than infection, polyps, endometrial polyps. So polyps in the cavity can be quite worrying because all uterus cancer start from polyp. I never say all polyp become cancer. It's all cancer start from polyp. So if you have polyp, you wouldn't want to keep it, right? Because it's potentially cancerous. Polyp is one. Fibroid is another one. Small fibroids in the cavity. So we can have fibroids everywhere. Yeah? Okay, so when you have a fibroid inside, you can have fibroid outside, you can have fibroid inside. So when you have fibroid inside, you can also have ovulation bleeding or intermenstrual bleeding. Last of all is what I mentioned a couple of weeks ago on isthmocele. Bleeding from your Caesar scar. So it's bleeding from a Caesar scar. So you have no growth, but you have a scar that didn't heal well, and that is why it bleeds. Okay, I think that's all. Thank you. Bye-bye.